Hello class, I'm going to explain to you the surface anatomy of the hip and gluteal region. We're first going to start with finding the iliac crest. The iliac crest is very easy to find. We just need to palpate on the abdominal side and inferiorly, and you can find the iliac crest. It goes all the way anteriorly and it goes posteriorly. The patient here is on an anatomical position, so you could be easy to find it on the anterior side. The next step we're gonna do is we're gonna find the anterior superior iliac spine. What we can do is we can still palpate the iliac crest and go inferiorly and follow the iliac crest until we get to the bone, the surface bone, and this bone would be the anterior superior iliac spine. If we want to find the anterior inferior iliac spine, we need to go a little bit diagonally, and then we need to go inferiorly, and here would be the anterior inferior iliac spine. Now we're gonna move posteriorly. So we're in the posterior position, and here we also gonna find the iliac crest that will be touching on the same side, and we will follow. And what we'll do is we're just gonna follow the iliac crest until we find the posterior superior iliac spine. So we keep going. And we will find it right here. Here is the posterior superior iliac spine. Now, if you would like to find the posterior inferior iliac spine, you will need to go a little bit down and medial, and you will find it. Also, from the posterior superior iliac spine, you will be able to find the sacroiliac joint, just 2.5 centimeters laterally, and it will come right here diagonally. This is where it would be the sacroiliac joint, the sacroiliac joint. Also, we are gonna find the ischial tuberosities. Is located deep within the glutei. They are pretty much the sitting bones. First, we're gonna find the gluteus maximus, that it would not be this side. Gluteus maximus, it would be around this side. So we also can find the ischial tuberosities located deep within the glutei. That will be the bone that you feel here. Anytime you sit on the edge of a chair, you will be able to find it. Also, we're gonna find a greater trochanter, that it will be located lateral to the hip joint. If you palpate it here, it will be a surface bone that you can feel, and you just need to find it while palpating it. Lastly, we're gonna find how to locate the spot where we can get an injection. In other words, would be, in anatomical words, would be the gluteal intramuscular injections. So we first gonna divide the gluteus in 4 quadrants, and it would be pretty much in the outer quadrant, and it would be, if you draw a line from the posterior superior iliac spine and you go downwards, you will be able to find all the way to the greater trochanter. You will be able to find a spot where you can put the injection. Knowing these anatomical surface locations are very helpful for medical purposes, are very helpful for any injuries that it will happen in your life, and is mandatory for every medical person that they need to know this. Thank you.